Okay, guys, let's talk about how to prevent. That's the prophylaxis of what hepatitis prevention. How do you prevent? Okay, in the prophylaxis of hepatitis, we're going to divide it into a pre-exposure and a post what exposure, guys. Okay, what do you mean by pre-exposure and what do we mean by post-exposure? Okay, in a situation whereby before you even get close to an individual who has hepatitis, you understand, you just decide to, like, okay, prevent yourself from developing that particular disease. It's called pre-exposure, before exposure, right? And then post, after exposure. Maybe as a medical doctor, you're treating a patient who is an hepatitis, who has hepatitis B, and then what do you do to prevent yourself from developing this kind of disease, this hepatitis B disease? Is what we're going to talk about in the post-exposure, guys. All right, the pre-exposure is quite easy. You just need to get an hepatitis B vaccine. You understand? You just need a hepatitis B vaccine. Hepatitis B vaccine, guys. And guess what? This particular hepatitis B vaccine is being made or gotten from what? The hepatitis B surface antigen. So how do you get yourself? How do you receive this vaccine? No, you receive this vaccine as an interval of what? 1 to 6 months. That's the time interval in which you take in this particular vaccine, guys. Okay, talking about the post-exposure. Now, the post-exposure could be, like I told you, after you must have a contact with a hepatitis B patient. Okay, now let's look at it this way. Maybe a mother is pregnant, and maybe in the course of following up with all this hospital follow-up, stuff like that, she now discovered that she has hepatitis. What do you do to prevent the child from getting what? Hepatitis. Simple. Now this is a good example about a post-exposure situation. So what you do is that immediately the child is born, you understand, you give him a hepatitis B vaccine. But you don't stop at only giving a hepatitis B vaccine. You also give him an hepatitis B immunoglobulin. Hepatitis B immunoglobulin, guys. You understand? First of all, you give this child this vaccine within the first 12 hours. The first 12 hours of birth, you give in this particular combination, the vaccine plus the hepatitis B immunoglobulin. Then after a period of 6 months, that's approximately 1 year, guys. Approximately 1 year, you now check this same patient, this same infant, again, this same patient that you administer this combination to find out the prevailing condition of the child. What will be your result if you are able to find out what this particular child has hepatitis B surface antigen? Wow, what does it tell you? It tells you that, man, this child is presently infected with the virus again. Understand? But peradventure, you're able to find out that this particular child has an hepatitis B surface antigen and an hepatitis B co-antigen. You understand? This particular result tells you that this child was infected with the virus, but the combination therapy you gave it to him, that means the vaccine plus the hepatitis B immunoglobulin has wiped out the virus from the system of this particular infant. But when you determine that this particular infant has only the anti-hepatitis B surface antigen, it simply means that this particular patient was infected as now he has developed an immunity against this particular virus, hepatitis B. Okay, now a second instance of post-exposure to the virus is, for instance, now an individual who has, let's say, for example, you have sex with somebody that, afterwards you realize that, man, this guy has, or this girl has what hepatitis B. What do you do to prevent yourself from developing hepatitis B? You, first of all, you give that group of patients, you give them, first of all, 0.04 to 0.05 what milliliters per kilogram of what the body weight, you understand, of what hepatitis B immunoglobulins, guys. You understand? These patients, they need the hepatitis B what immunoglobulins for them not to develop what hepatitis what B. You understand? So far so good, but in a situation whereby a patient has hepatitis, let's say chronic hepatitis B, that now lead to the what hepatocellular carcinoma. The only option you have to save this particular type of patient is what? Carry out a liver transplant. That's the only option. That's the only place where surgical therapy comes into play, when we have what when we have a progression toward hepatocellular carcinoma. That's cancer of the liver. Okay, now with this particular at this particular junction, we call it a day to our lecture on what hepatitis. And I hope you guys have fun, and I hope you guys have enjoyed everything, and I hope you guys will be able to what cure people with hepatitis. Go out and shine. Bye bye.